have all long heard for years about the benefits of healthy chiropractic care. Of course, a lot of people are maybe a little hesitant to address chiropractic care, but as one who's been to a chiropractor, I can tell you, it does make a world of difference. Dr. Matthew Lester is here joining us this morning. Dr. Lester, Well-Adjusted Chiropractic. Good to see you.
Good to see you.
Off the bat right away, what does it mean to be well-aligned?
Oh boy, Chip, that's a great question. So, for example, like, we get a lot of patients with migraines.
Right.
And that usually comes from a malalignment of this up here, right? Mm-hmm. So, what does it mean to be well-aligned? Well, think about if you go to work every day and you have a migraine when you wake up and you have a headache all day long. And then you come in and see me or another chiropractor, and within 3 or 4 visits, those headaches start to dissipate. Instead of every day, they're every other day. And then after 2 or 3 weeks of care, you haven't had one in a week or 2 weeks, and so it can be life-changing.
And when you have a migraine headache,
yes,
you know,
sir,
there's nothing you won't do, no amount of money you won't pay to get some relief.
Exactly.
I wouldn't have thought that migraine headaches would have been started right up around here. What's the underlying cause when you have one of those migraines that begins here?
Chip, that's a great question. So, for example, in the spine, besides your eyesight, every single nerve comes out of the brain and goes into the spine and then comes out of the spine, and that's these little yellow lines right here. Mm-hmm. For example, the nerve that comes out right here, which is this bone right here,
gotcha,
comes to the side of your head just like this and just like this. And that's why most migraines or most headaches will start in the back of the head, right around here, and then pound all the way to the front.
How do you treat, we'll stay with the subject of migraines,
yes, sir,
for just a couple of minutes. How do you treat a migraine starting up here?
Okay, so great question. So for example, the patient's gonna come in, they're going to tell me they have migraines. I'm going to do a full exam. I'm going to take x-rays. And usually what I'll see on the x-ray is, like, for example, I would see this bone right here. Instead of being straight like this, I'll see it turn just like that right there.
Ouch.
And it's stuck. Well, when it does that, these nerves come out. When it turns and gets stuck, it pinches that nerve. When it pinches that nerve, it causes the muscle tissue to tighten up. For example, like a lot of medical doctors, they'll do Botox shots right back here, which will temporarily leave the migraines because the muscle's been relaxed. But the problem's still there, so when the Botox wears off, migraines come back. The difference with this is we're actually fixing the problem. And so as we fix it, the migraines get less, and then they stop, because we're taking that bone very gently and taking it from an example like right here, and slowly over time, putting it back in place.
What is the biggest complaint people come to see you about?
So, the biggest complaint would probably be low back pain, mm-hmm, and that's probably 60% of our patients, because most of our jobs today are sitting down.
Right.
The other people would be headaches and severe neck pain.
All right, let's stay with the back pain.
Yes, sir.
I've been there, done that on a regular basis. What can I do before coming to see you to make sure that my back is properly aligned and in the best shape I can make it?
Okay, so for example, one of the best things you can do is when you get up. What do cats and dogs do when they get up? Every time
stretch.
They stretch.
Yeah.
And God gave us these big, huge brains, and we overthink everything, and we stop stretching. So, for example, every morning when I get up, when I get in the shower, once my body gets warm, mm-hmm, is I'm going to lean forward, and I'm going to go to touch my toes the best I can without bending my knees.
Without bending your knees.
You got it. And then I'm going to immediately go backwards, just like this, mm-hmm, just like a dog or cat does.
Right.
And then I'm going to go side to side. And that should not hurt when I do this.
Sometimes it does.
Right. If it does, that means there's probably a bone out of a line back here. For example, just like the headaches in the low back, right? We're sitting down, we're crossing our legs, we're in cars, we're using our right leg just for the gas and brake. So these hips get off. When these hips get off, it causes these bones in the back to get off. Well, when the bone gets turned, just like in the neck, pinches the nerve in the neck, causes migraines. When this bone gets turned in the low back, now you either have sciatica or you have low back pain.
And both of those will make you say things and think things you really shouldn't be. Tell me what you have here.
Okay, so this is a great question. So for example, what we're showing right here, this is a perfect, healthy vertebrae and disc. Mm-hmm. And so what we're showing you right here is we're showing you this right here.
Right.
And the way God made us is the way our discs get blood is by movement. So for example, if this bone gets turned and stuck, right, and it's not moving, this disc will start to degenerate.
Gotcha.
And then, of course, everybody's been to their doctor and been told that they have arthritis. Okay, well, what arthritis is, author is Latin for joint, mm-hmm, itis is Latin for swollen. So if you go to your medical doctor or to a chiropractor and they say you have arthritis, that it can be fixable because it's a bone that's out of place, and we put it back and take away the arthritis.
So this is a perfectly healthy, normal one.
Yes, sir.
Show me one that's the other side of that coin that's
okay.
on here.
So what happens is the bone will get out and gets locked,
Right.
and now that bone's not moving, so that disc starts to degenerate. So for example, these are examples of disc degenerating.
Let's see. Let me pick the worst one here.
This right here.
This one right
Yes,
here.
sir.
All right.
So we can look at this one, and we can see the nice healthy fat disc.
Right.
And that's made that way to keep the nerves from touching the bones, right? So if that bone stops moving and that disc degenerates, that disc is getting smaller, which now allows that nerve to get pinched, okay? So that's what we're showing right here. This person, what happens first is a disc degenerates, then your body starts to build bone called osteophytes. Well, what happens is this gets worse and worse. When you come to the chiropractor, we're gonna take an x-ray, see that. We're gonna start moving that joint. Well, what happens is that disc will start to dehydrate. It'll start to go back to normal.
Wow.
And that's why you may get a little sore. But now instead of bending to here, you can bend down and touch your nose because we're putting that bone back in joint.
One thing that has been one of the predominant schools of thought for decades and decades is I either have to see an MD
Yes.
or a chiropractor. Yet both specialties can peacefully and beneficially coexist.
Chip, we play in the same playground. And all I want to do is help people.
Right.
So like if you get help from the MD, that's awesome. But we see MDs. We have MDs come in our office regularly, orthopedists, anesthesiologists. My most common patient is a nurse.
I can understand that.
And what happens is, like the anesthesiologist, the surgical techs, they see the repeat surgeries, right? And they see the person go from this, first surgery, now they're this, second surgery, now they're this, third surgery, they're this. And they see those repeat people, and they don't want to be those people. And they end up coming into our office, and we fix them.
Sometimes I know in my own little private world, when I'm getting up, sometimes it's, you've heard of an airplane doing a 3-point landing. Sometimes it takes me 3 points to actually get to where I can stand up straight. So I could definitely benefit from chiropractic care. We only have a few seconds left. Do you have a favorite patient story, without naming names, you'd be willing to share?
Oh boy. So what I love the most about being a chiropractor is watching people get better. And what I'll see, like in ladies especially, is they don't feel good. They're either having headaches or severe low back pain. So they're not fixing their hair, they're not doing their makeup, they're not dressing the best because they don't feel good. And it's like I had a lady come in Monday in her 60s and she didn't feel good. So yesterday she comes in, I'd seen her Monday, Tuesday, and Wednesday. Yesterday she comes in and her hair's all done, her makeup's all done, and she's happy. And she's full of joy because she's feeling better, and she's hurt for so long in her low back.
Sure.
It was affecting her sleep, it was affecting her relationship with her husband. And she's telling us how she can turn her head for the first time.
And just like that can be a downward spiral when you're in the process of getting unaligned, it can be the reverse on the way up. Dr. Lester, thanks so much for joining us. Come back anytime. You can find out more about Dr. Matthew Lester at Well Adjusted Chiropractic. That's Well Adjusted Chiropractic. We're back in a moment.